Colon cancer, a silent yet deadly force, often begins without any noticeable symptoms, quietly developing from tiny, seemingly harmless polyps in the colon's inner lining. If left untreated, these polyps can evolve into aggressive tumors, ultimately spreading to other organs and threatening the body from within. Tragically, many people discover their diagnosis too late, after the cancer has already advanced, making successful treatment far more challenging. This article will uncover what colon cancer is, how it affects the body, who is most at risk, and how vital early detection and lifestyle changes can save lives. Along the way, we'll also explore how modern medicine has made strides in treatments and survival rates. If you're interested in staying informed about health issues like colon cancer, consider subscribing to Dr. My, sharing medical knowledge. By doing so, you'll have access to valuable insights and the latest medical updates that could make a real difference for you and your loved ones. Don't forget to like this article and leave a comment if you have any questions or thoughts to share. Colon cancer, also called colorectal cancer, begins in the colon or large intestine, an essential part of the digestive system responsible for moving waste through the body. This cancer originates from small polyps that form on the inner lining of the colon. Although most polyps remain benign, certain types can transform into cancerous tumors over time, often taking up to 10 years to do so. This slow progression means that early detection is possible and, more importantly, life-saving. Screening tests play a crucial role in detecting these precancerous polyps before they develop into tumors. However, when colon cancer isn't caught early, it can infiltrate the layers of the colon wall, spreading to nearby lymph nodes, blood vessels, and ultimately other organs. This spread, known as metastasis, is particularly dangerous and is why colon cancer remains one of the leading causes of cancer-related deaths worldwide. Colon cancer doesn't discriminate, affecting individuals across various demographics. It is currently the third most common cancer diagnosed in the United States. Though historically more common in those aged 50 and above, colon cancer has been rising among younger adults, with an alarming increase of 1.5% each year for those aged 20 to 49. The reasons behind this shift remain unclear, but it serves as a reminder that no one is immune, regardless of age. The disease disproportionately affects Black Americans, who are more likely to develop colon cancer than other ethnic groups, possibly due to a mix of genetic factors and disparities in access to early screenings and healthcare. Men and people assigned male at birth also face a slightly higher risk than women and people assigned female at birth. This is why regular screenings and awareness of symptoms are essential for everyone. Staying informed on these issues and learning about ways to protect your health can make a difference. Remember, if you find this information helpful, don't hesitate to like, subscribe, and comment on Dr. My, sharing medical knowledge to support our efforts in spreading vital health knowledge. One of the reasons colon cancer often goes undetected in its early stages is that symptoms can be subtle or mistaken for other conditions. Even if you have no symptoms, it doesn't guarantee that you're free from risk. However, some warning signs may suggest colon cancer, and understanding them can help you catch potential issues sooner rather than later. Blood in or on your stool can be a sign of colon cancer, though it's also associated with less serious issues, such as hemorrhoids. Persistent changes in bowel habits, such as chronic constipation or diarrhea, could also indicate a problem. Unexplained abdominal pain, bloating, and even fatigue might suggest anemia, a potential side effect of colon cancer. If you're experiencing these symptoms, consult a healthcare provider. They'll determine the cause and, if necessary, perform a screening test to rule out colon cancer. Early screening saves lives. By detecting colon cancer at a treatable stage, we can increase survival rates. So, stay proactive about your health, and encourage others to do the same by subscribing to Dr. My, sharing medical knowledge for regular updates on crucial health topics like this one. At its core, Colon cancer begins when normal cells in the colon lining start to grow and divide uncontrollably. These rogue cells often arise from polyps, which are abnormal growths in the colon's mucous membrane. Not every polyp becomes cancerous, but certain risk factors can increase the likelihood that a polyp will turn into cancer. These risk factors include genetics, lifestyle choices, and underlying health conditions. Smoking, for instance, raises the risk of colon cancer, as does excessive alcohol consumption. Obesity and a diet rich in red and processed meats are additional lifestyle contributors. On the health side, people with inflammatory bowel diseases such as Crohn's disease or ulcerative colitis are also at a higher risk. Family history is another key factor. Those with close relatives who have had colon cancer or advanced polyps should be especially vigilant about screenings. If you find yourself at a higher risk for colon cancer, it's essential to have regular conversations with your healthcare provider about early screenings and preventive measures. Every precaution helps, and by keeping informed, you're taking a step toward protecting yourself and your loved ones. When a healthcare provider suspects colon cancer, they use several tests to confirm the diagnosis. Blood tests, such as the complete blood count, CBC, or carcinoembryonic antigen, CEA, assay, can indicate abnormalities linked to colon cancer. Imaging tests like X-rays, CT scans, MRIs, and ultrasounds help detect the presence of tumors and assess their spread. In many cases, a biopsy, removing a sample of tissue for analysis, provides the most definitive diagnosis. Colon cancer is classified using a staging system, from stage 0, precancerous cells, to stage 4, cancer that has spread to distant organs. The higher the stage, the more advanced the cancer, with later stages posing a greater challenge for treatment. Stage 0 is often curable with early intervention, as the cancer is still localized within the mucous membrane of the colon. Stage 4, however, indicates that the cancer has metastasized, requiring intensive treatment to manage. The primary treatment for colon cancer is surgery, particularly in the early stages when the cancer is contained within the colon. Surgery might involve removing polyps, performing a partial colectomy, where part of the colon is removed, or in some cases, creating a colostomy to help the body manage waste. Alongside surgery, additional treatments such as chemotherapy and targeted therapies are frequently used, especially in more advanced stages. Targeted therapies, for instance, attack specific cancer cell characteristics, which can make treatment more effective and minimize side effects. Radiation therapy and immunotherapy are other options that may be considered based on the cancer stage and patient health. This array of treatment options showcases the strides that have been made in colon cancer care. Through early detection and modern treatment approaches, the 5-year survival rate for those with early-stage colon cancer is now over 90%, offering hope to millions. Though not every case of colon cancer is preventable, adopting a healthy lifestyle can greatly reduce your risk. Avoiding tobacco, drinking alcohol in moderation, maintaining a healthy weight, and engaging in regular exercise are all impactful. Dietary choices, too, play a significant role. Increasing fiber intake from fruits, vegetables, and whole grains while reducing red and processed meats is one step toward a healthier colon. Most importantly, follow screening recommendations. For many, screening should start at age 45, but those with additional risk factors may need to begin sooner. Screening options vary, with colonoscopies being the most comprehensive, though stool-based tests like the fecal immunochemical test, FIT, and fecal DNA test offer less invasive alternatives. Thanks to advances in screening and treatment, the fight against colon cancer is stronger than ever. Yet, there's much to be done, particularly in spreading awareness about early screening and lifestyle modifications. If you're encouraged by this information and believe in the importance of preventive health, consider subscribing to Dr. My, sharing medical knowledge. Together, we can raise awareness and educate others about the steps they can take to safeguard their health and reduce the impact of colon cancer. Colon cancer may be a formidable challenge, but with informed choices, proactive care, and the support of medical science, it is possible to face it with resilience and hope. Stay vigilant, prioritize your health, and never underestimate the power of knowledge. Don't forget to like, subscribe, and share to support more health-focused content that could help others live longer, healthier lives.